Hello, everyone. Welcome to the Global Gastroenterology. Today, we welcome our guest, Dr. Nada, and she's a gastroenterologist, hepatologist, and from Egypt. And she has wonderful accomplishments. And we'd like to know more about from Dr. Nada. And thank you, ma'am. Can you please tell us about your journey? Where have you been worked? Where are you currently working? And what are your leadership roles?
Okay, perfect. First of all, thank you, Dr. Omar. My pleasure to be with you today, invited for this wonderful platform. I admire the idea. It's very nice to have people from different places worldwide talking about their experience in our field. So it's a great, keep it up. And thank you for inviting me. Let me introduce myself. I'm from Egypt, Nada El-Domiaty from Egypt. I graduated from the medical school of Zagazig University in 2010. And then I started my prep in gastroenterology and hepatology field as a resident in the university. And then I did my master degree. And then I had my scholarship to go to France for PhD. And this was a great, wonderful experience for 5 years. Then back to my university here in Helwan University. Currently, I'm working as associate assistant professor of gastroenterology and hepatology in Helwan University. And maybe you can ask me to go more in more details if you want. I have a long
Sure.
story, so feel free to ask and I will answer.
Sure, doctor. So I was just looking at your profile, and it's really impressive. So I saw that you did your PhD, you did your diplomas in the France, and you had a lot of research contributions. How was your journey, and what are these diplomas about? So mostly we see
Yeah.
that physicians have one niche; they go into one particular area of their interest. But I was looking at you, you are into advanced procedures, hepatobiliary, IBD, and it was really impressive, and all from the different universities. And how was your journey, and what inspired you to be this well-rounded gastroenterologist?
Okay. Actually, the prep for the PhD was very successful prep and again a lot of experience. First of all, that's why this is an important message I want to deliver to all the young doctors. Try to go out of your comfort zone. Try to be everywhere while you are young. You still have the energy to go to discover the different fields. And this is what I did, and this is what you found in my biography. I tried to have the different experience in different fields. Go to the maximum. If there is like a diploma and this is the maximum thing you can reach in this university, I will do it in this field to be an expert or to have the basic knowledge so I can continue on this. When I started my trip to France for the PhD, it was 2018, and I was selected by my university to have a scholarship for this. And it was for hepatocellular carcinoma and liver transplantation. This was the topic of the PhD. And when I went there, I discovered that it was like, first of all, it wasn't easy because of the language. So I started from scratch to learn the language beside my work in the hospital and doing my PhD work. Uh, it took for me like 1 year to have the language, so you can be fully integrated in the system. Having like 5 hours each day for 1 year, 12 months. I do remember the school of the French to get the language and then go to be integrated in the system. Then I accomplished my PhD work by the third year. During the first third year, 3 years, I started to do different diplomas, as you can see in my biography. I did a diploma for the intensive care unit for the for hepatology and liver transplantation, and the other one for the oncology and the hepatobiliary oncology. And then I had another one for the inflammatory bowel disorders, Crohn's and the ulcerative. And then after in the because I went back to Cairo and then back to France working in a postdoc. So I had my NASH diploma again from university in France. And the last one that I ended, it was for the US eco endoscopy. So it's the message that you have to make the maximum effort to use every single moment that you have while you are young, because as you are going more deep in your step, you will be like a little bit less motivated. So this is what I'll try to do to have a lot of experience. I took a promise that I should add a new thing every year in my CV, and this is what I'm trying to do since I graduated from the medical school. So this is what about the journey to France.
All right, that's really impressive, doctor, and it's really inspiring for the young gastroenterologist. And it's our honor that you are our guest today, and you bring a lot of expertise. And thank you so much again. And one thing before moving forward, I am having a lot of distortion in your images, I guess, because of that background. If we can fix
Okay.
that,
Yeah, I'm trying to fix now.
I guess when you move, then it gets.
I will
Uh,
try not to move.
okay, thank you, doctor. All right. Thank you so much again for being our guest today. So you have worked in Egypt, you have worked in the France, and I guess these are a lot different healthcare systems. And what do you feel like? What are the differences in the healthcare related to the digestive health in France, and what are the differences in Egypt?
Let's first tell you the system in Egypt. Okay, in Egypt we have two systems. The main one is the public one, and then the private system. The public one is university hospitals, the Ministry of Health hospitals, and then the private is either private clinics or private hospitals. So do you know you know the population in Egypt is we are now 120 million. So this put a big pressure on the system, the governmental system here. That's why we have now NGOs. They are growing too much, trying to help to cover different areas, especially the rural areas. Maybe the difference between the Egyptian system and the French system was the insurance, the health insurance system. In France, I think it's much more stronger. The infrastructure is already there, and this is the main difference that I find that the people there they have the insurance system. It's very efficient and well covered by the government. This is what we are trying to do now here in Egypt, but it's still due to the population, the 120 million. So not all the people are covered by the health insurance system, and this is the main issue here.
All right, doctor, and thank you so much. And you have expertise in liver transplantation, I guess, both in France and here in Egypt. And I was speaking to a gastroenterologist from Nigeria, and he was mentioning that they don't have any transplant center in the Nigeria, and if they have to get the transplant center, they have to go to the Egypt or India. So I just wanted to know how liver transplantation works in Egypt and as compared to the France.
Yes, as I told you, my master degree and my PhD degree was in liver transplantation. So the liver transplantation in Egypt now we started this since from 30 years. So we have a huge experience in living donor liver transplantation. Okay, we're not doing cadaveric, and this is the main difference between here and in Europe. Europe they are doing both. The mainly is cadaveric. Okay, so in Egypt in Africa we have a huge experience in Middle East also for the living donor liver transplantation. Okay, compared to the European side, I mean, or America. In Africa, your question was that there is no liver transplantation and they need to transfer some patient. Yeah, we have a lot of collaboration here between different universities in Egypt and in Africa uh, regarding the liver transplantation, because I told you we have an experience with a living donor liver transplantation. And this is what we make Egypt is an expert uh, country in living transplantation in the Middle East and in Africa.
All right. Thank you. Thanks so much, doctor. So I just wanted to know about how the process works, how the evaluation happens, and how the referral happens, and how much cost it roughly if it's not government funded, I guess. So you have any rough estimates of all the things about our audience?
You are talking about liver transplantation.
Yes.
Yeah. Okay, now in Egypt, if you are talking about Egypt especially, we have like we can say 20 center of excellency for liver transplantation, because Egypt is a huge country, so we have in a different places. Okay, and we have multidisciplinary teams everywhere in each hospital to organize the liver transplantation process from starting. As I told you, we have living donors, so we have to prepare the donor. We have to find first the donor, and should be from the relatives, and then we have to do pre-assessment for the donor and recipient to be sure. It's a very long process. Okay, it takes time to finalize and to make sure that they are compatible together, and then we go for the procedure. And the follow-up after the procedure also is very, very important. And this is what maybe we are missing a little bit here in Egypt, and this is what we are working with in the patient education regarding the post-transplantation follow-up journey. The patients sometimes they thought that they did the liver transplantation and it went perfect. There is no need to continue following. And this is what we are trying to do, doing a lot of campaigns talking about the importance of post-transplantation follow-up. And this needs a lot of awareness campaign. Okay. Regarding you asked me about the pricing.
Yes.
Yeah. Okay. We can say now that liver transplantation from a living donor in Egypt costs like 50,000 or $60,000. Okay, and this is expensive and huge. That's why uh, a lot of people try to reach the governmental support. Okay, and the governmental support could cover like 50% of this. And in the severe urgent cases, they covered it, fully covered by the government.
Interesting, interesting. Thank you, doctor. And to my understanding, people from other countries can also come and have the living donor transplantation in the Egypt, but I guess they will not have the government support in that.
Definitely, we have a lot of patients that came from the Middle East, from different areas in Africa, and they should have their donors with them. As I mentioned for you, it's living donors, so we should have the compatible relative patient or relative donor to the patient. And yes, for sure, they should support cover the expenses. Yeah, it's not by the Egyptian government.
All right. Thank you, doctor. And what do you think? What are the prevalent causes of liver failure in Egypt, especially? I'm sorry, doctor. I just lost your voice. I can't hear you. It's not audible yet.
Now it's okay. Hello.
Yes, now it's audible.
Sorry for this. As I told you, in Egypt, we suffered a lot from hepatitis C. Okay, we
Okay.
suffered for years and years from hepatitis C, but we had a national campaign. It was a very very successful one, and it started in 2000, I think 16. Okay, uh, for screening all the people in Egypt. So we screened all the people in Egypt, the population, and the government support the treatment. They give them the new treatment, DAS treatment, for free, fully covered by the government. So it ends by that we are celebrating now that Egypt is the first country worldwide that eliminate the hepatitis C. And that's why, going back to your question, hepatitis C was the first indication for liver cirrhosis and so the liver transplantation.
That's really amazing.
But we did a great success story in this part. The elimination of hepatitis C wasn't easy in Egypt, especially with the huge number of population.
That's so amazing. And what are the trends of the fatty liver? Do you see it's getting higher? It's almost the same as compared to the Western countries, or like it's not a
Ah,
big concern now?
fatty liver now is getting the first indication for liver transplantation worldwide, and fatty liver is a new era now. Okay, so after the elimination of hepatitis C, treating hepatitis B, we start to see even here in Egypt or in France fatty liver everywhere, because especially in the last 2 or 3 years, the diagnosis and the diagnostic tools for fatty liver and NASH have been evolved. That's why we will discover more and more cases about NASH and fatty liver. Yeah.
Doctor, do you have any advice for our general audience who are listening to you, like how we can prevent this from happening?
Regarding the fatty liver.
Yes.
Okay, this is what we are doing, trying to advise the patients every day in the clinic. Uh, Try to have a healthy lifestyle. Try to eat healthy food for sure. Try to keep your body well by doing like at least 30 minutes movement, whatever the movement that you are going to do, but just move for 30 minutes every day. Try to avoid the overtake of alcohol. This is very important also, and the healthy food. We are just considering this issue is very important,
Thank you.
not to
Thank you,
gain weight.
Doctor. Thank you, Doctor, for your advice. So now, before moving to your next areas of interest, I would like to share that I was speaking with our guest from Pakistan, and I just asked a question, that our routine question: what are the barriers of the colorectal cancer screening in Pakistan? And because of the cultural differences, it's and one of the main factor was lack of female gastroenterologists, because the only female patients wants to be get can get only the colonoscopy by the female gastroenterologist, but it's a male dominated, I would say, for now, the specialty, and it's a huge barrier for the colorectal screening, especially in the east, because of the cultural and the religious differences. So I felt that there is a huge gap, and unfortunately we can't do anything. But then I got to know about you, about your initiative, woman empowerment in GI endoscopy, and it's really impressive, and I guess it's contributing a lot. It's contributing a lot, about the woman empowerment, more women in the field of endoscopy. So can you please tell us more about your this initiative WEGE and what it does,
Yeah,
and how it's making differences in patients' life?
yeah. Thank you, Omar, for this interesting question. Really, and I know my friend from Pakistan. Yes, this is I'm totally agree because we have almost the same issue in Egypt. It's related to the culture, related to the religion. Some female patients prefer to have female doctors. Why we don't have still the sufficient number for females doctor that can do in endoscopy or colonoscopy, especially in the rural areas. And that's from here, this was one of the most important aim or goal of our initiative that we created last year in Egypt to empower more female endoscopists with knowledge, with skills, so they can do colonoscopy or the interventional or the diagnostic endoscopy that we need. And this will help definitely for the national screening program here in Egypt for the early detection of colorectal cancer, because here also we have one of the most important initiative, presidential initiative here in Egypt is the early or the screening for colorectal cancer. And that's from here we start our WEGE program, trying to have more and more scaled female endoscopists. Sure, we have wonderful female endoscopists here in Egypt, but we need to increase the number. And
Yes.
that's why we create this program to train more and more female doctors, to have our network, to have our common society where we can discuss together the same problems, the same issues that we are facing everywhere as a female endoscopist.
All
And
right.
we are waiting for all of you for the next one. We are doing our next annual meeting in September. Wish us luck.
Thank you. Good luck, doctor. It's really impressive initiative. So I just wanted to know more about you, how it works, and how people enroll to your these initiatives, how often you have your meetings, and what kind of training you provide to the anyone who is interested, and how they
Yeah,
can
okay.
connect with you.
Okay. As I told you, we started our launching event was last year in September. And this was the launching event here in Egypt to say that we are here. And then after we start to organize like different webinars, and we are working now to have our school training programs, but we are trying to tolerize it to fit well with the doctors, not in Cairo only, because you know Cairo is the capital of Egypt, and this in Cairo in you can find everything. but still we need to go more deep everywhere in Cairo, different places. And that's why we are working now to finalize for the next year. After the conference in September, we have the conference in September this year, with a lot of crash courses for training for different techniques, hands-on training courses beside the scientific lectures. This will be condensed 2 days for all the female doctors. It's not only included for the just only the female doctors. We are also targeting the young endoscopists that need support. Okay, we said, okay, it will be mainly for the women, but last year, what we had in our training, in hands-on training, we find young doctors, male doctors, that they are willing to join to train, to be trained. So they are almost welcome. Okay. And regarding how to contact us, you can find the program and the next year agenda in details regarding all the training courses that we will do in our web page and in the pages in the social media like LinkedIn or Facebook.
Thank you so much, doctor. If someone from other countries want to join this program, they are welcome, and it's really amazing. And I'm really thankful to you for this initiative.
We had last year friends from different countries from Africa, and we are expecting this year to welcome more and more friends, just to have a more big network in Africa and Middle East.
And, thank you, doctor. Thank you so much. And now we'll move toward our next sections for the how prevalent is the colorectal cancer in Egypt, and what are the common factors you wanna tell our audience.
Okay. And Egypt, the colorectal cancer is considered that the second common cause of death. Okay, this is a high prevalence, and the risk factors that we have here is the, again, I will say bad lifestyle. Uh, People are starting to have more and more fast food, and this is not okay. Smoking, also, this one of the smoking is one of the most important risk factors here in Egypt. So we can say it's a lifestyle, not healthy food, and the
Mm.
smoking is the most risk factor. Beside the genetic factors, we cannot forget this also. Yeah, and
Thank you.
almost the same risk factors that I find in France also.
Mhm. And doctor, how often people should get screened? What's your advice when they should start getting the colonoscopy? Any other alternative test do you recommend if the people are not comfortable with the colonoscopy? What are your expertise? What's your advice to our audience?
Thank you. This is an important question also because people are usually afraid to have colonoscopy. Once we start having patient in a consultation and start talking to him and have the family history, the medical history, and we decide to ask him to do colonoscopy, he gets afraid and no, I will wait. Can we have another investigations? I just want to ensure the patient that colonoscopy is not that difficult at all. It's a very easy procedure. You will be sedated and just we need 30 minutes to check your colon from inside the mucosa to be sure that there is no like a small polyp which might become malignant one. But if we remove it early, it will end with a happy end. Okay, so don't afraid to have the colonoscopy or the checkup. And once you start, even either you have a family history. If you have a family history, cancer colon, you should ask your doctor for consultation and ask when we can do the screening colonoscopy. It's very important. Or if you have any symptoms like continuous abdominal pain or bleeding per rectum, constipation, diarrhea, changing in the bowel habits. So you have to seek your medical advice.
All right. Thank you, doctor. So I was just wondering, like in Egypt, to see a gastroenterologist, does it need the referral from the primary care providers, or people can see directly a gastroenterologist?
Here in Egypt, you can see directly the consultant or the specialist without needing to have the primary care specialist. Yeah.
Sounds good. Thank you, doctor. So now your other areas of expertise about the IBD. So I saw in most of the countries, it's less prevalent, especially in the East Africa, and they associate it to just the Western disease. How much prevalent is the IBD in the Egypt, and can you give your insights up on that?
Yeah, actually, IBD also is one of the most important diseases that we start to see more and more, as I told you, because of the improvement of the diagnostic tools that we have now. This diseases need a lot of work from the patient as well as the doctor. It's not only the treatment, the medical treatment that we give to the patient. It's also about his lifestyle and how he will be patient to reach our target together. The genetic part playing a very important role in this disease. And that's why my advice to all the patients, once you have a symptoms like constipation, diarrhea, the abdominal pain, abdominal distension, it's very important to seek the medical advice without waiting, saying that it's an irritable bowel or something like this. Please seek the medical advice, and you have to be diagnosed, because if we early diagnose the irritable bowel diseases, we can treat it. Inflammatory bowel diseases, we can treat it from the beginning.
Thank you, doctor. And it can get complicated and it can get worse. So, early detection and the treatment is very important for the Crohn's disease, ulcerative colitis. Thank you, doctor.
Definitely.
And what do you think about the biologicals, infusion centers? Do we have enough resources regarding these treatments of the inflammatory bowel disease, and how people perceive it? Like sometimes people are a little bit hesitant to go for the biologicals. And what are the trends in Egypt, especially in Cairo?
No, in Egypt we have all the new biological treatment are fully covered by the health insurance system here in Egypt. So once the patient have a sure diagnosis by the colonoscopy and all the scores that we have, and he diagnosed with the disease, we refer them directly to the centers of expertise for regarding this disease, and they start the treatment, biological treatment, according to the protocol that we are designing for the patient, definitely, and the multidisciplinary team after this. And he can start his treatment with the biological treatment fully covered by the insurance system here.
And that's really impressive. And how people perceive it, like they are a little bit hesitant to go for it, or they are educated to go for the biologicals.
No, the people now, they prefer to go for the biological treatment because they heard that the success rate is very high, so they are so excited to try.
And that's interesting to know, doctor. So I was just reading about you. You have a lot of scholarly work, publications. Would you like to bring up any Egypt or Cairo pertinent research that you have done recently?
Our research now that we are doing here in Egypt, we are trying to concentrate more about the NASH, as you said, trying to check the genomes and the genetic factors for this disease. So this is what we are trying now. We have like a team interesting in this part for the NASH, and there is a difference in the genetic factors between here or in Europe and Asia. And this, I see, it's very interesting now.
Interesting. Thank you, doctor. And it's really amazing. I had the opportunity to discuss like a different areas from our one guest. And thank you so much again. So before moving to our last question, I would like to know, like, as you mentioned to our young gastroenterologists or healthcare providers to keep going, be very motivated. Do you have any suggestions for them to avoid the burnout? Like sometimes they're very passionate and they are like doing a lot, and then comes the burnout and they can't even sustain. So what's your advice for them to avoid the burnout and keep a good work-life balance?
Yes, a wonderful question as usual. Because I'm facing this problem everywhere, but I'm trying now to be more calm because I had the experience now. So my advice for all the young endoscopists: try to put your plan, your program, what you want to achieve after 5 years, after 1 year, 3 year, 5 years. Don't be so hurry. Take your time, gain your experience. But please try to make the balance between the work and life, because work will never end. So you have to enjoy your family, enjoy your life, enjoy your age. You're still young, so you have to do a lot of experience, not only regarding the work, regarding your life, your friends, your family. At the same time, for the work, put your plan, put your program, what you want to be after 5 years, after 10 years, and try to make a very small, even if it's a very small steps, you will reach your goal after 1 year, 2 years, whatever, whenever you will reach it, you will reach it, but do a very little steps. It's exactly what I had when I went there to France. I found that I cannot communicate with the people, and I need to have my PhD. I need to gain experience from here. So I start a very small steps. It seems like, how can I say bonjour? Ça va? It was very difficult, very small steps, but it ends up now that I'm speaking French fluent. I'm having my consultations. I'm talking with the patients. I have a lot of friends now. So baby steps, but sure steps, and go
That's really
out from your comfort zone. The success starts when you decide to go out from your comfort zone.
that's impressive and inspiring. Thank you so much again, doctor. It was a pleasure meeting you, and I hope we had a lot of clarifications on few things, especially related to Egypt and France, liver transplant, IBD, colorectal cancer screening. And in the end, I would like to thank you again for all these wonderful initiatives, and I really wish you best of luck for its
Thank you
success.
so much. Thank you for the invitation, and best of luck for the your platform. It's a wonderful one. Thank you so much.
Thank you, doctor. Have a good evening.